Yeah, hi everyone. I want to thank Lauren and Pathways and PM&R for having us present about Emory University PM&R today. I'm Nicholas Hooper. I am the academic chief resident for Emory PM&R this year. I'm also joined by my co-chief, Derek Fox, who is the administrative chief resident for Emory this year. And so we'll go ahead and go through kind of an overview of the program. So our typical rotation schedule and sites, as well as our academic didactic experiences, where our residents kind of go following residency. And then also what makes Emory unique in kind of life in Atlanta if you're not as familiar with the city. And then at the end, since we're the only presenting residency program today, we'll be open to answering any questions that the anyone may have. So, in terms of rotation, so the way our curriculum is broken up is every rotation is 2 months. So this is throughout all 3 years. We are an advanced program, so you do have to do your intern year. There is an option to do it at Emory as a TY or an internal medicine intern. But again, it is an advanced program. So as a PGY2, it's the bulk of the inpatient experience. So you do 6 months at Emory Rehabilitation Hospital, which is a freestanding rehab hospital that's adjacent to Emory University, the main medical campus. We are connected by tunnels, but you do 6 months, 2 months on stroke, 2 months on medically complex, which is more SCI, and then 2 more months on medically complex, which is more oncology, LVADs, things like that. Um, you do then 4 months at Shepherd Center, which is a very well-known rehab center in Atlanta. You'll do 2 months on spinal cord injury and 2 months on brain injury, and then you do have 2 months of outpatient experience as a PGY2, and that's kind of a mix of a lot of things. So sports med, spine, spinal procedures, and cancer rehab. As a PGY3, you do 2 months on pediatric rehab at CHOA, which is Children's Hospital of Atlanta. 1 month of that is inpatient, 1 month outpatient. You do go back to Shepherd for 2 more months as a PGY3 as the senior to do SCI. And then you get to do 4 months at Grady, which is the safety net hospital in Atlanta. 2 of those months are dedicated more towards EMG and Botox. And then 2 of those months are more acute care consults. And then the rest of the year is filled with 1 month at ERH, 1 month elective, and then a little bit of outpatient MSK and procedural stuff at the Atlanta VA. PGY4 for the most part is outpatient. You do have 1 month inpatient at Emory Rehab Hospital, and the rest of the time is spent with our sports medicine staff in the pain clinics or spine clinics or doing EMGs or general rehab at the VA. So to go a little bit more into the different centers. So Shepherd Center is a very well-known rehab hospital in Atlanta, Georgia. It is a self-standing rehab hospital. It's a model system for both spinal cord injury and brain injury. So those are the two main things Shepherd Center will focus on is SCI and brain injury. We have an in-house ICU. So it's a 10-bed ICU, and this is staffed by pulmonary specialists and ICU physicians. So we do take higher acuity patients at the Shepherd Center that most rehab hospitals would not take because we have the ICU capabilities. And that also being said, if patients start to decompensate while at Shepherd Center, if they're on the rehab floor, we do have the capabilities to keep them in-house and do all the imaging and all the workup we may need to stabilize them and send them to the ICU in-house if need be, which is again a little bit different than a lot of rehab hospitals. um, in terms of call, so it is home call. We take the residents will be first call from during the week from 6 p.m. till 10 p.m. and then overnight your second call. And so there's always an APP in-house who will take first call overnight. So you don't need to take any calls after 10 p.m. until 6 a.m., which is really nice, which makes the burden of of the call, much less than it used to be. And again, kind of I touch base on these a little bit. It's a very unique hospital, very much so world-class facility, staff. You see the highest acuity of traumatic injuries, and you also get to have great experience taking care of vent-dependent patients and working with the pulmonary team, especially with high level tetraplegia to try to wean them from the vent. And the other cool thing about the Shepherd Center is they typically will keep patients for anywhere from 2 to 4 months. So you really get to see the progress of the patients while they're inpatient, which is very different than most rehab hospitals, which only keep patients for about 2 weeks. Emory, or sorry, go ahead, Derek.
Oh, so I can touch on ERH and some of the other rotations. Um, Going back to Shepherd Center a bit more, it's kind of like this rehab utopia in a sense. Like you really get to see how rehab is done at the highest capacity. The rec therapy program at Shepherd Center, rec therapy isn't something that's insurance reimbursed. And so it takes philanthropic endeavors and efforts from a hospital in order to do rec therapy. And so Shepherd raises a lot of money in order to do that. And so there's a really a whole army of rec therapists, and there's you know in-house facilities where there's so you can see the swimming pool there. There's a gym where there's Paralympic or kind of wheelchair basketball sporting events, kind of soccer and all that going on in the gym. And so you really just kind of get to see how kind of rehab can be done in a perfect setting. And so you get that great experience. And then you also get a really good experience at ERH when it comes to how rehab might be how it might look more so in the community or at kind of your typical academic center, where you might be wearing multiple hats and doing some case management in addition to the medical care you provide, and doing a lot of, again, just taking on multiple roles and just making sure that you understand how to take care of a rehab patient and what goes into starting kind of their discharge and their journey home from day one on admission. And so there's a few services at ERH, and you work with a few attendings there down at the bottom. From left to right, it's Dr. Milton, Dr. Coley, and Dr. Jones. And so at Emory, Emory University just being a very complex stroke service and getting a lot of crazy stroke syndromes, you see really about every stroke syndrome there is. And just to be able to have that clinical experience and work with patients with all types of stroke syndromes is extremely important to just reference in your future practice. And so you have a couple services where it's really just some more stroke or brain injury based, working with patients that have had intracranial tumors and have had neurosurgical interventions for those. And then there's also on with Dr. Jones and Dr. Coley, more so spinal cord injury, polytrauma, transplant patients, anywhere from liver, kidney, lung, and then LVAD, left ventricular assist device patients as well. And then also you get a pretty good amount of exposure, and it's in kind of increasing as Dr. Jones, who's a oncology rehab trained specialist, we're getting more exposure to cancer rehab, which I feel like generally isn't something that most places have a ton of exposure to, and it's something that our program has developed more so in the past couple of years. Thankfully, internal medicine of both a physician and a nurse practitioner are consulted on pretty much all the patients there, and so to have that to lean on is helpful. Just to have another set of eyes to catch things and kind of help you and provide recommendations on a daily basis. They're available 5 days a week, and even at times they'll say, "Hey, you can text me really at any time to ask about certain medical issues," and namely, kind of blood glucose, diabetes management, blood pressure management, and things of that nature that are more bread and butter medicine things, which you probably do a lot of during intern year, but you kind of pump the brakes on that and focus more on the rehab side of things when you get to PM&R training. As far as call goes at the RH, so here at this program, you get a mixture of both at-home call at Shepherd, like Nick was talking about, but then you get in-house call exposure at ERH, and it is a fair amount. You average about 30 call shifts during your PGY 2 year, about 20 during your PGY 3 year, and then, and this is solely at ERH, notwithstanding the Shepherd call that's at home. And then you have about 8 call shifts on Thursdays as a PGY4. Traditionally, those have been paid. And we can get into some of the details later on. But there's some financial issues that have happened across the country where some of the financial aspects of every program in the country have been impacted. And so that's something that's been impacted. But you do get a post-call day, which is very nice to basically be done early or mid-morning and kind of have the rest of the day where you don't have any clinical duties. And you get about 5 or 6 hours of sleep on average. Sometimes I'll hit my sleep goal at ERH overnight for 7.5 hours, and just be kind of ready to go and do whatever the next day. So it's kind of nice to have almost, in a way, an extra day, half day off in that sense. And as a third year, like Nick was saying, we get to spend some time in Grady, which is a level 1 trauma center, safety net hospital, the only one in Atlanta. So that serves a great population, a very large population. So you see everything. You see the worst traumas, see the worst spinal cord injuries, you see the worst brain injuries, and you see them on the consult side of things. There's a new inpatient rehab unit that has opened up there for the past year, and there's a potential that we'll end up rotating there as residents and expand the residency. And so you just get great training with Dr. Hendricks down there on the left and Dr. Monica Branch down there on the right when it comes to the consult world of PM&R. And additionally, there's multiple outpatient clinics. Dr. Hendrick has a spine clinic as well as a procedure day. He's phenomenal. He kind of lets you do whatever you're comfortable with, allows you to practice as much as autonomy as you want. You get great procedural experience in his fluoro suite. And then additionally, you get a lot of Botox injections as well. I think I've counted or logged about 70 to 80 through PGY2 and PGY3 year. And then you also get good EMG exposure with Dr. Branch. And again, you get a lot of dependence and autonomy or independence and autonomy there as much as you're comfortable with.
Yeah, you'll want to like I still remember my first day working with Hendrix in the Florist Suite. Like he'll show you one basically, and then with his supervision, you're basically able to do interlaminar, lumbar, and cervical interlaminars and TFESIs like truly on your own with his supervision as long as you're comfortable with it. So again, there's ample opportunities to get spinal procedure numbers if that's something you're interested in.
And then also in third year, you spend a couple months at CHOA, 1 month on the inpatient side of things and 1 month on the outpatient side of things. So a fairly well-rounded pediatric rehab experience. You get to work with some of, the leading uh, practitioners in spasticity management in the pediatric world. Both Dr. Vova, they're we'll kind of go from left to right. Dr. Poplawski, Dr. Vova, they're down kind of second left. And then on the far right, Dr. Enoch Leung, those two are doing cryotherapy and cryoablation for spasticity. So kind of essentially just freezing the nerve that would service a specific muscle group to allow for improved range of motion and muscle relaxation of a given muscle group and then therefore joint. So you get a ton of procedural exposure and really advanced procedures both under ultrasound and electrical stimulation guidance. You get a lot of exposure to baclofen pump changes and management, titrating the medications, refilling baclofen and pumps as well, and troubleshooting when they go wrong. A lot of exposure to P&O as it relates to kids with cerebral palsy. There's a lot of DME, durable medical equipment, and P&O needs that those kiddos have. Working at the VA during your third year is, all outpatient based, pretty smooth, kind of 8 to 4 kind of gig. You get amputation, medicine exposure. You get a lot of exposure with EMG and peripheral joint injections. Mostly landmark guided. There is, some opportunity for ultrasound guidance, but just depends on how the flow of the day is going. But you really do become very comfortable with landmark guided shoulder and knee injections, trigger points, greater trochanteric bursa steroid injections. And so again, it's just really bolstering your skill set from, both when it comes to procedures, both an anatomical landmark guided standpoint, and then also ultrasound guidance, which really comes more so along in fourth year, which we'll touch on in a little bit.
Yeah, and I can talk about this a little bit. So, one of the big things for Emory is their musculoskeletal medicine, both institute and kind of practitioners. So the MSK Institute itself is a freestanding outpatient clinic that does have an ASC, so an ambulatory surgical center. And this is where we do a lot of our spine and EMG rotations as a fourth year. So in-house, there's orthopedic, spine care, physical therapy, MRI, anything you may need, and a whole floor actually dedicated to research. And here on the second floor is where you'll get the majority of your spinal procedures outside of Grady. You'll work with from left to right. The two big ones on the left are Dr. Monfort and Dr. Swee, are PD and APD respectively. And then to the right, it's Dr. Cruz and Dr. Harmon, who are two of our EMG and generalist MSK providers. Um, and they're all fantastic at EMG. They're all certified in neuromuscular medicine. So it's a very good learning opportunity all in all. And right,
I would put Dr. Harmon up against any electrodiagnostics provider and
yeah.
teacher in the country. He's an absolutely brilliant guy. He's done an electrodiagnostics fellowship. He was in I think he did engineering when he was an undergrad. It might have been biochem, but he's done a PhD. I mean, the guy's brilliant. He's super nice and he's a great teacher.
And then one of the, I think, big draws for the program, it was for me, is the sports med curriculum and opportunities. So right next to the MSK building, which we just talked about, is the sports Emory Healthcare Sports and Hawks facility. And so this is actually the practice area for the Hawks, as you can see in the photo there. This is where a lot of our sports medicine providers work. So you can see the five main ones we work with there. So on the left is Dr. Jerome. He's heavy into orthobiologics and research. Dr. Bowers is next to him. Again, great source provider. Does a lot of neurogenic thoracic outlet and um, management of shoulder pathology and overhead athletes. In the middle is Dr. Kinnear, who you get to work with as a PGY2. And then Dr. Montner and Dr. Olafate. Dr. Montner is one of the leaders in the field of sports medicine and orthobiologics. And Dr. Olafate is actually dual boarded in both sports medicine and interventional pain or spine. So he's also a great resource to have. And so this is where we get a lot of our ultrasound guided, as well as ultrasound guided procedure training. We do all the forms of orthobiologics, so PRP, BMAC, MFAT. We do ultrasound, more advanced ultrasound guided procedures. So we do Sonex, which for those of you who don't know is ultrasound guided carpal tunnel release. We also do 10X, which is basically ultrasound guided tenotomy. And then Dr. Modner will actually do ultrasound guided compartment releases for chronic exertional compartment syndrome. So there, and for that alone, there's only about 8 providers in the country doing that. So you really do get to be on the cutting edge of the procedural side of sports medicine with this group. So I can go over this a little bit. So our didactics and lectures. So we basically have lectures every Tuesday and Thursday morning, and the curriculum will repeat on a 12-month cycle. So the goal is for residents to see each lecture or topic about 3 times. Obviously, at the end of every cycle, we do talk to residents and get feedback in terms of things they want to see more of and things they want to see less of or think they can do without. Tuesday's lectures, again, this is all dedicated lecture time, so it's protected time. Tuesdays from 7 to 9 a.m. Thursdays are from 7 to 10 a.m. So you do get a fair amount of protected time. And on those days, typically, if you're inpatient, the inpatient attendings will write notes on on your patients. So you really just have to go and see new patients and admit. We also do both spine and orthobiologics MSK journal clubs, and this is ran by Dr. Monfred and Dr. Jerams, respectively. And we do have a biostatistician who will also come to these journal clubs to offer his input on the statistics involved in the research. We do have Canvas for the residents every 2 weeks after a rotation, you will have to do competency modules and take a quiz. So that's just to make sure everyone is staying up to date and they're meeting their rotation-based learning guidelines. In addition, we get multiple board review materials. Cucurullo is provided to all residents, as well as Bradham's. Um, and then every year there's also a sports medicine symposium that the sports medicine team puts on. And then again, we do M&M and morning report. This is something that every resident has to um, give a lecture on once during their residency. So once you do one M&M and one morning report, you've fulfilled your requirements for graduation. And one of the big things for us, especially, is trying to get more hands-on workshops. So we have it's about a 3-month ultrasound block, and this is taught by our sports med faculty. We take a dedicated days, dedicated Thursday and Tuesday for each joint, learning how to do the physical exam first, and then learning how to ultrasound that joint, and then also do guided procedures with the ultrasound for that joint. Um, and the sports medicine fellows, there's 4 sports medicine fellows, non-op sports medicine fellows at Emory every year. And so we work with us very closely, and they'll help give one-to-one feedback and guidance when we are doing our ultrasound didactic curriculum. In addition, other than ultrasound, we do our pediatric faculty will do a advanced procedure workshop with ultrasound. We'll have fluoro workshops for spine procedures every year, and um, we'll also do like cool leaf and disc bore lectures every year. And this was kind of a little bit more what I was talking about in terms of other workshops. So we have EMG as well, the spine procedures, Botox. We do have a backlift and pump one as well. And then every year at Shepherd, we have a wheelchair seating lecture and clinic where we actually get to practice different forms of wheelchairs and different sorts of adaptive equipment. So head arrays, sip and puff, everything that you can imagine when it comes to using a wheelchair. And sorry, I know we're going a little long, so I'll try to finish this up. There are global health opportunities. We have had residents in the past go to the Dominican Republic for mission trips, as well as Emory's pretty heavily involved with the WHO. One of our former program director, Dr. Burke, actually is one of the leaders for the WHO for the South kind of East area, the Caribbean area. So there is opportunities for that as well. And then other resident perks. So as a PGY4, you do get moonlighting opportunities at ERH on Thursdays, and that's paid call. There is conference reimbursement. I know with a lot of the changes and just cuts to um, with the political environment, this has changed a little bit. It used to be 1,500 per conference. It's gone down a little bit. So that is something that could change in the future, but we do always get 5 education days / conference days a year. We do have $900 for educational allowance over 3 years, and that's something that's protected. And then when you are at Shepherd, both at Shepherd and ERH, you do get money for dinner, breakfast, lunch, whatever it may be. So where our residents go, we have a history of matching very well. You can see kind of the last 7 or 8 years or so of match. And it's really across the board, whether it be pain, SCI, NAS, sports, or really just generalists. We like to say the amount of exposure you get during this program in the 3 years, you really would be able to come out and do any sort of general PM&R and procedural is we have a resident who didn't do a fellowship and he's out there doing lumbar procedures. So you really do get a ton of hands-on experience to feel and to where residents really do feel comfortable going out and practicing without a fellowship. But again, this is all available on our website, so you can see where people used to match as well. And then just overall, what we feel like makes Emory special. So there's a lot of sports coverage if you are interested in sports. So that goes mass event coverage. Atlanta has the largest 10K in the country every year, which just happened, the Peachtree. So we cover that. We cover and a large amount of high schools. So there's always sideline opportunities, and we also do sports physical as well for Emory University specifically. But our attendings cover multiple different universities, Georgia Tech, Clark Atlanta. So there's always additional opportunities to get sideline coverage with those universities or participate in those physicals as well. If you have more specific interests, like adaptive sports, there's opportunities for that. If you're interested in dance medicine, we have an attending who covers professional dancers. So it's really kind of open to you. If you have a specific interest, there are definitely attendings who cover those things, and you just have to seek it out. And we do a lot of events as residents together and also attending. So we always have a welcome party at Dr. Katz's house, which is here, every July to welcome the new PGY2s. Every fall, we'll do a wellness retreat. Historically, we try to go up to the North Georgia mountains as a group, and we'll rent a cabin, but it changes every year. And additionally, we have multiple holiday parties. We try to get together as a residency once a month or once every couple months, whether that be at a brewery or for a dinner or somewhere in Atlanta. But we try to stay pretty close, especially as a class, but as a residency as a whole. Um, I went over this a little bit already. You can see at a Brave game, us tubing the Chattahoochee River, or us at different bars, Atlanta United game or professional soccer. Atlanta as a whole is a great city. I know I'm originally from upstate New York, which is pretty rural. So I was a little worried because the first thing you always hear is how bad the traffic is. I mean, it's the traffic's not great, but also you can usually get anywhere you need to go and avoid the interstate. Um, you do get all four seasons, but it is a pretty temperate climate. It's one of the most green cities out there. There's Piedmont Park, which is huge, like arguably, I don't know the exact size compared to Central Park, but it's massive. You're only about an hour and a half from the North Georgia mountains, where there's a ton of hiking, cabins, as well as wineries. The beaches are only about 4 hours away. And then, like we've talked about a lot, there's a lot of professional sports teams, as well as festivals. So in a large urban city like Atlanta, there's always something to do, for whatever you like to do. And so just to summarize really why Emory is a great fit for PM&R, it's really broad experience in all the fields of PM&R, and it can really prepare you for any fellowship or job that you may want to take. We have a pretty robust faculty mentoring program as a PGY2, and we try to pair you based on interests. So that can help facilitate trying to get you closer to whatever your goals are as a physiatrist. You get a ton of procedural opportunity, and truly by graduation, you're doing lumbar procedures and possibly even cervical procedures on your own. You get great experience at both Shepherd and ERH from an inpatient neuro rehab experience. There's moonlighting opportunities, and obviously Atlanta is a great city to live. So again, we want to thank Lauren and PNMR Scholars, and if you have any questions, feel free to email us. Our emails are at the bottom. Again, my name's Nick. Derek is my co-chief. And at this point, if there's any questions, we're more than willing to take anything you may have.
Yep, thank you so much, guys. If anyone has any questions, you can drop them in the chat at this point. So Isabella asked, will Emory be requiring a standardized letter of evaluation or an SLOE for apps this year, or is it just a recommendation?
From my understanding is it's just a recommendation. So yeah.
Mhm.
Rochelle said, I know you mentioned this, but do you and your fellow residents feel supported throughout your time in Emory?
I think overall, yeah. There are moments I think where you're going through some tough inpatient months, especially ERH, where staffing is, a little bit difficult, as is most places. Don't have enough nursing staff at times on some shifts, don't have enough patient care techs. It's a 48 bed inpatient hospital, two floors, 24 patients per floor, and sometimes it'll be overnight just in the evening two PCTs, and so that can make things difficult. A bowel regimen might not be implemented that you had planned early in the day, and so that makes you just I don't know, sometimes feel like, what am I what am I doing? I'm trying to arrange this care plan and it doesn't get implemented. I think, up until recently, we had with all the financial changes and budget cuts, and again, I think that's something that's happening most places. Just because of some of the changes at the federal level. The budget for the program had to be cut by about 33%. And so those cuts have to come from somewhere. And when you have certain things like self-assessment examinations every year that cost a good amount of money, as well as the program trying to support your licensure, reimburse you for your licensure, and then also try to do, some conference reimbursement at, CME monies. Uh, some money has to come from somewhere, right? And so, unfortunately for us, when it comes to our social budget, that's kind of one of the areas where things have been cut. And so, I'll be honest with you, that's a little right disheartening as a resident, because you don't feel in a way that the program right, you can feel that the program isn't valuing the togetherness or the camaraderie of the residents because of that. But at the same time, you kind of have to step back and understand the very difficult position that the leadership and the kind of the powers that be are at when it comes to things that are being changed that they don't have a control over. So it's
Yeah, I think it's a lot of you get really close with your co-residents. And I think at least every class itself is very close. And then obviously we're close as a whole residency. So, I mean, we all support each other a lot. Like me and Derek in my class all just went out for dinner earlier tonight. So, you're constantly doing things from that perspective. From an academic perspective, there's so much support. I mean, I started doing research with some of the sports faculty before I even got to Emory. As soon as I matched here and I still had my intern year, I started doing research with them. So everyone's more than willing to help you get where you want to go in the field. So from the academic side, there is a ton of support. It's pretty incredible.
think the next question here is about, is it very important for a student to have a rotation with Emory to be considered or live within the Atlanta region? And I would say overall, no. No, that's a no to that question. I
Yeah, I don't
personally, I didn't
think,
have a away rotation with Emory. I'm from Indiana, went to University of Florida for medical school. It seems like there's always a couple people that come from Florida, kind of one per year almost. But there always is every year one or two, and sometimes it can fluctuate year to year. I think this PGY2 class currently, there's two that went to Emory School of Medicine. I think three, maybe four did away rotation here, and then an additional one aside from the two that went to Emory is from the Atlanta area, just outside the city. But that just fluctuates. I mean, that's kind of just general demographics and population
yeah,
statistics in a sense, but it's
yeah, like
not, yeah,
yeah,
crucial in
our
anything.
class, not one of the six of us did an away rotation here, and only one of us was from the region of Atlanta. And so I don't think it affects. I think if you do an away rotation at Emory, it's a guaranteed interview.
Yeah.
So obviously that's a benefit. But otherwise, it's not something that at all is something that we take into account location wise. What what was the deciding factors that drew me to residency or drew us to residency at Emory over other places? For me, it was the exposure. I came into residency knowing I wanted to do more of a procedural field, whether that be pain, sports. was also heavily into research, and I knew kind of just looking at the program, kind of the amount of experience you get in residency alone, you're more than comfortable coming out doing any of the procedures, and then um, if you do want to do a fellowship, it sets you up really well for fellowship anywhere in the country. So that was important for me. Obviously, you want to be a well-rounded physiatrist, and I think Emory as a whole, like if we have to pinpoint something, I don't think we get the best amputation exposure, but it's something we're working on, and we're adding more into the curriculum, especially with peds, to try to have more P&O and amputation exposure. But overall, it's just a very well-rounded program, academic program, and really, it's there's anything you may want to do, there's ample opportunities.
Yeah, absolutely. It really felt like to me, I ranked it number one just because I felt like I would, out of the place that I was able to interview, it was the program that would train me the best, both on the inpatient side of things and the outpatient side of things. And some people are predetermined when they go into residency as to what they want to do. But regardless, if you're even predetermined what you whether do inpatient or outpatient, this place has great exposure to both. Again, both at Shepherd Center and then at ERH. And then also all the outpatient stuff that Nick's talking about, and all the procedures. You have no problem hitting your procedure numbers. You get hundreds of EMGs. Like I said, I'll probably eclipse 100 Botox injections, hundreds of joints injections. Like it's not even close. And so, again, from the standpoint of you get great exposure in both inpatient and outpatient is a big draw to the program. And at least it was for me.
All right, I'm
I
gonna
just want to
combine two.
interrupt really quickly. Sorry. I'm
All
just
right.
going to drop in for anyone that has to go. Of course, we'll continue with questions as long as they're willing. I'm just going to drop in the Pathways and PM&R website and any upcoming events. We always have applications open for features in our PM&R humanities and PM&R and Humans of PM&R and Reflections in Rehab, which is our humanities journal that we're recruiting for right now. So if you're interested in any of that, please feel free to just submit something. Why not? And then we have upcoming the virtual residency fair, lots of sessions upcoming. So keep an eye on the website and our social media for that. I will turn it back over to you guys, and you guys can run the questions as you want. I just kind of wanted to throw that in there for anyone who is interested in anything further with Pathways and PM.
I'm going to combine two questions because they're both about research. So the two questions are you required to do research during your time in the program? And then the second question is, for research in the residency, do you feel like you're supported? And then are there options to have dedicated research time during the residency? So are you required to do research during your time? The short answer is kind of. So every year we have a resident research day. It's on the day of graduation. And every resident is required to present something. One year it has to be a QI project, and then the other 2 years it can be anything. It can be a case report. So really it's bare bones. If you don't like doing research, like you can just do a case report. In terms of if you want to do a lot of research and in terms of support, there's absolutely ample support for research during residency. Like, I'm sorry, my dog is just going at his bone. It like personally, I think I have 16 research projects right now, and I've felt nothing but support. All the attendings are super willing to help you in any way. Some of the attendings are willing to put up thousands of dollars for article processing charges. There's free statistician help through Emory, so you don't have to do any of the statistics on your own. They'll run it for you. So really, at that point, you're just writing the paper. But there's also, if you're not the best writer, there's writing support as well. There's an English PhD who can help you write the research. So like I said, I think the research support is fantastic. In terms of dedicated time during residency, not really. You do have elective time, but you're kind of required to have more of a clinical base to that. But if you want to have like half a day or something just for research, that's something you can choose to do. And I think there was a question about electives, and we'll get to that next. But you can during your two elective months, one as a three or one as a yeah, one has a three and one has a four. You can definitely like take a couple of days or something for research. So
Yep. Yep. Gets a little bit of elective time, yeah, as a 3 and a 4, and it's just completely create your own schedule, which is really nice. And I
Yeah.
guess it's a little bit intimidating
Yeah.
in
And
a
for
sense
that
for some
question, like,
people, but I love being able to do whatever I was interested in.
yeah, so for the question about electives during PGY2 and PGY3, PGY3 you do get a full month elective and it's like a choose your own adventure. So basically you just reach out to attendings that you want to work with and or something you're interested in, and you figure out days you can work with them. There is the opportunity for up to a week you can go to another program or somewhere and do research or do clinical duties, doing away basically, both as a 3 and a 4. But as of right now, Emory limits that at a week. So that's kind of the maximum time for that. As a PGY2, unfortunately, there's not dedicated elective time, but there are those 2 months that you do have that's outpatient, and it's it's a very broad 2 months. So you get some spasticity stuff, you get some interventional pain, spine exposure, you get some sports exposure. So you kind of get to touch base with every aspect of the field during them 2 months as a PGY2.
I think the next question that we haven't touched on is were there any experiences or qualities in your residency application that helped stand out to Emory? And do you have any recommendations looking back on your applications? I'm trying to think back of what Monfred has told me about my application. I don't think we've talked about it much. But I think generally, like looking for a well-rounded individual, right? You have academic experience, you checking some boxes for research, certainly, generally, right, doing well when it comes to the didactic and then the clinical rotations. But I think another big thing is just like involvement outside of your typical medical student duties of lecture and rotations and research when it comes to, doing other like, so I was involved in like a singing and kind of like a cappella group called White Coat Company, University of Florida, and we did plays and we did shows throughout the year. Involved in a lot of athletic things, and so just kind of random neat things like that that get to showcase who you are and that you have a lot of, interest, you're a well-rounded person, and that you kind of have your hands in a lot of cookie jars, I guess, so to speak.
Yeah, I mean, I would echo that. I mean, we get to take part in interviews this year. I don't know what they thought about my application, but I think what they look for is really just a well-rounded application. I mean, they'll look at your board scores. I think it's just step 2 now, but I mean, they're not going to put everything on step 2. They're going to look for someone who is involved in the community, is involved in things outside of medicine, but then also it has a decent academic scores and maybe some research experience, but it's not something that's required either. You don't have to have a bunch of research in order to rank highly at Emory. How supportive are we for international medical graduates? Actually, pretty supportive. Surprisingly, I don't know the last time we had an IMG match at Emory, but I know we do interview a lot. Like I didn't partake in interviews last year, but I did see our rank list and we did take part in the interview socials, and there were a fair amount of IMGs. Our program director, Dr. Momford, actually was an orthopedic surgeon in his home country before he came here, so he himself is an IMG, and so he definitely doesn't hold that. It's not something where we're exclusionary against them. He definitely as long as it's a good candidate, he sees you as a good candidate, and he'll will interview equally. So I don't think at all. I think our program is highly supportive. I just think if you look at our graduate list, I just don't think we've had one in a little while. But we do interview a lot, and we do we do support them. Yeah. Any other questions, clarifications? Cardio pump. Good question. Ton of opportunities on electives. There's only a 3-day requirement as a PGY2. So we do have a pretty robust cardio pulm rehab clinic in Emory, it's St. Joe's, I believe. So it's about like 30-ish, 45 minutes outside the city. It's not too far away. So you're required as a PGY2 to do 3 days with them. And it's great. Like I loved it. You learn a lot. And then if you really want to have more exposure to that side of things, you can do part of your elective with them. We do have actually a lot, both from the cardiopulmonary side. You get to work with a sports cardiologist a little bit, who's one of the top sports cardiologists in the country, Dr. Kim. He's fantastic. Um, so there is a lot of exposure. It's just the minimum is those 3 days as a PGY2, but there's obviously if you really want to take advantage of it, you can do more during your elective. Um,
Grady.
Grady, high acuity, mentally drained with the cases we've seen.
Yeah, man, you see some really tough situations. I mean, golly. And so yes, I mean that is emotionally, mentally draining. I mean, just like, if you can think back to some exposures in medical school, right? Going through this now, where during on your clinicals, right, you see the first patient that passes away, or your first major trauma, where you see someone trying to be saved on an OR table and they're not. And you see some really bad situations where there's a gunshot wound to someone's neck, and they were an athlete about to go Division I football, and now they're probably never going to walk again, or be able to use their arms functionally, and so they're going to be in a power chair and dependent on their family for caregiving. And so yeah, that's tough. That's tough, but that's the nature of this profession, and everyone deals with that in their own way. I'll say that the Grady attendings are extraordinarily compassionate, between Dr. Hendricks and Dr. Branch. They are absolute pillars. They're great people to lean on. They're just full of wisdom, kind words, and support. And so, you know, you're going to probably experience those things over your couple months on consults, where you have to break horribly bad news to somebody who may not be ready, and that'll be difficult, but you got to do it, and you have to be trained on it, because at one point in time in the future, the buck stops with you, and you're the
Yeah.
boss, and you got to do it. And so to have those experiences is something that I would want out of a residency program. I'd want a lot of them. I'd want to be exposed to them and feel comfortable doing it when I have no one else really, to lean on that significantly in the moment. Um, but yeah, yeah.
Yeah, the attendings are never going to put you in a situation you're uncomfortable. I think it's like graduated, like you do deal with a lot, but I never think it's to the point you're completely mentally drained. Yeah, I think you learn over time, especially intern year, how to cope with kind of situations like this. And I mean, I can tell you from experience, 2 weeks ago, I was at Grady and I had to talk to a 21-year-old who was I think it was like a low cervical Asia A. So I mean, complete spinal cord injury is never going to walk again. And again, this is where at Grady's where you really get experience having those difficult conversations. Like I had to talk to him and really break the news to him that this is what we see. This is kind of how he's presenting, and based on all the information we have, he's not going to walk again. So it is something that I mean, if you're going to get comfortable having those conversations, the time to do it's during residency and in a very supportive environment with supportive attendings.
And aside from spinal cord injuries, there are very, very bad traumatic brain injuries that you
Yeah.
see from whether it's gunshots, whether it's violence, whether it's more often motor vehicle collisions. And you have conversations with family about next steps after someone has not had any response for going on 2, 3 weeks, and what the general trend or expectation is when it comes to their future functional abilities, or what their life would probably look like, and would they want that for themselves. And so you almost wear kind of a palliative care hat, and you have family conferences with palliative care, and the trauma team, and again, us as rehab. And again, extraordinarily hard, certainly takes mental and emotional energy. But I started to, once I got past the kind of nervousness and anxiousness of those moments, and got a little bit more comfortable in those moments, there was an interesting feeling when it came to kind of having a very deep, difficult conversation with the family, and kind of walking alongside them in their understanding of what's going on and what would maybe be or likely be what their loved one wanted for themselves if they were in this situation, and finding some uh you might not have certainty, but finding some solace in the decision on next best step, and kind of having some element of closure or sureness in making a very hard decision.
Yeah. So fellowships that Emory has. So yeah, I mentioned sports. So there's four sports fellows. We have an interventional pain fellowship or pain fellowship. They have six fellows. There's pediatrics fellowship, pediatric rehab fellowship. They have two, two or one, but they only take it every other year because it's a 2-year fellowship. We have NAS, which is non-accredited, but it's combined pain and sports. We just started a new fellowship that's non-accredited. It's just a procedural fellowship. So it's a lot of like spasticity, baclofen pump refills, some spine stuff. I'm kind of all over a little bit. And then Shepherd has an SCI fellowship and a TBI fellowship. So basically any fellowship that you'd want to have exposure to, I think we have. Any recommendations on how to inside a smaller, if a lot of research and other exposure is heavy in sports medicine, so recent or rehab adaptation, same function, or if I should include. Good question. So I think a lot of that comes interest-wise, just in the interview. I don't think like having a specific interest, especially on your application, like in your personal statement or something like that. I don't think that's gonna stop you from getting an interview if as a whole you look like a very good applicant holistically. Then in your interview you just really need to show that you're just interested in the whole field and come across that way. Personally, um I my whole personal statement was about sports. All my research was in sports. I had some publications with orthopedic surgery as well, and I would say definitely include them. So if someone looked at my resume, you may think I was applying ortho, or you may think that my only interest was in sports. But again, then once you get to the interview, you just really need to show that you have more interest than just that, even if you just need to show that you're really open, basically. But I would definitely include any early research and publications, include everything. Yeah.
Yeah. And the thing is too, it's kind of just how you approach the training in general. I mean, and like people get it, especially at Emory. You have a lot of people that come here that are very interested in sports or spine, and they're kind of predetermined from the start that that's what they want to do. But even so, if you're like that, you try to take a step, and this is advice from Dr. Olafade, who did a sports fellowship and did a pain fellowship. But he said, just be where your feet are and learn what you can in the moment that you're in. Because you're going to be studying musculoskeletal, you're going to be studying the nervous system, right? Peripheral nervous system. And like that's extraordinarily important for spine and pain and sports. And so use that time when you're in kind of inpatient rehab side of things and you might not be doing something that you plan on doing for the rest of your life to build a good foundation for what you will be doing in the future or the coming years. And then additionally, it's good to just have that tool in your toolbox to be, to feel comfortable doing inpatient. You might get asked to do a few weekends a year as an academic faculty. You could do moonlighting to make extra money on the inpatient rehab side of things if you're a sports fellow or a spine fellow or whatever. One of the current pain fellows that was an Emory grad 2 years ago, he did a lot of moonlighting at a rehab facility here, and I mean, that's helped him a ton when it comes to being able to support his family and all that. And additionally, Dr. Monfred, he was an orthopedic surgeon in Iran before coming to the United States and starting to practice PM&R. So, that's not gonna just be who you are, be what you're interested in. But just same thing in med school, just be where your feet are and learn what you need to learn to build a foundation for your future. What we got next? Any opportunities for any residents to engage in global PM&R? National volunteering electives. There's just going to be, it's not like built in to a curriculum. It's going to be very self-directed, but there's a lot of support for it. Like you said, Dr. Burke was our previous program director, and he is heavily involved in WHO. We've had residents most years, at least one resident has done some sort of international medical missions trip. Whether it's been to Peru, the Dominican, we have one this year who's trying to go to the Dominican in March, and the program is extraordinarily supportive of that. It'll just be self-directed.
Any other questions before we finish up? Yeah, like I said, y'all could have gotten our emails at the end of the PowerPoint. If you have any specific questions about Emory, feel free to reach out to either of us. We're more than willing and open to talk about the program and all it has to offer. So yeah, anything at all, and best of luck with M4 year. Enjoy it.
Yes, the best
Well,
year.
at least enjoy the spring.
Post-match, yeah. Post-match is the one of the best times of my life.
Yeah, wish I could go back to post match. It's a good period.
All right, y'all. Thank you
Take
all for
care.
coming. Feel free to reach out. Take care.
All right. Thank you all so much. Have a great rest of your day. Join us for the other sessions.